All right, so we're on reviewing the practical 2. So you have your epidermis right here. It's a more superficial layer made up of what kind of epithelium? You're going to remember. What stratified squamous, multiple layers here. Good. All right, then you have inferior to that or deep to that, you've got the dermis, okay, where your glands, your receptors, hair follicles are. And then you got your hypodermis. You got some blood vessels and a lot of adipose tissue. Okay. All right, so here you got here's your sweat gland. The sweat gland duct goes out to the pore. These glands around the hair follicles are sebaceous glands. It's the rectus abdominis muscle, helps make the hair stand up. And here's your hair follicle. All right. So this is adipose tissue or fat cells. This is a Pacinian or lamellated corpuscle, right? Remember lamella are rings. You see all the rings in there. So it's a lamellated corpuscle, right? So helps you kind of sense pressure on your skin, things pressing down on your skin. All right, on the nail, you have your little half moon structure there. It's a lunula, like lunar. The skin fold that attaches to that is the cuticle. And then the darker area on your nail is the body of your nail. You can see that from the cross section as well, the body and the cuticle. Okay. Thick skin versus thin skin. Thick skin has a lot more stratum corneum, right? Okay. Where do we find thick skin? Palms of your hands and soles of your feet. So you'll see that. You will see at least one of these slots. I can tell you that. Okay, so just be ready. If you see lots of stratum corneum, it's thick. If you don't see very much, it's thin. Make sense? All right. So skeletal system, which you need to know here. And you got some spongy bone here where the endosteum is. That's the inner lining. On the outer lining, that's that periosteum. You got some concentric lamellae here. Each ring is a lamella. All the rings that are in one kind of section of circles, we call that an osteon, also known as a Inversion system. Okay, but whether you're looking at this collection of rings or this structure, it's an osteon. All right, so look at the bone models on your table. You should be able to see that. All right, you should be able to see one that's at least one that sticks up. Okay, those collection of rings are an osteon. And then you have these here, also an osteon. These little spaces here, we call those lacunae, and that's where the osteocytes, the bone cells live, right? All right, sections of a long bone. The long shaft is the diaphysis, where you'll find the medullary cavity. Okay, and you've got your compact bone around the medullary cavity, and lining that compact bone is periosteum. On the ends of the bone, you have the epiphyses. Each one is an epiphysis. And on the inside of that epiphysis, you're going to see spongy bone. All right? But can everybody see the difference between the spongy bone and the compact bone? All right. So if I ask you a question, I say which skeleton, I have a picture of a skeleton out here and I got something labeled on it. And I say which skeleton it is, don't tell me it's the skeleton. Of course it's this skeleton, but remember when I asked you that, what I'm asking you to tell me is it axial or appendicular. All right, so axial skeleton contains your skull, your ribs and your sternum, your vertebral column, right? Upper part of your skull is the cranium, the lower part is the facial bones. Thoracic cage contains your ribs and your sternum. Remember the ribs, you have 1 through 7, which are true ribs, right? And why are they true? Because they connect to the sternum via the costal cartilage, right? And you have 8 through 10, which are false ribs because they don't connect directly. They connect through 7, right? And then you have 11 and 12, which are floating ribs because they don't connect at all. Okay, good. All right. And here's your sacrum, right? But this is all in blue. This is all axial, right? Everything in yellow or off-white is appendicular, right? So, right, there's the clavicle, scapula. Okay, you got your humerus, where the radius is on the thumb side, ulna on the pinky side, carpal bones, metacarpals, phalanges. And we have our coxal bone here made up of the ilium, ischium, down here in the pubis over here. You have your femur, patella, right? Large bone here is the tibia, smaller bone, fibula, ankle, you have the tarsal bones. On the foot, you have the metatarsals, and then the toes are the phalanges, right? But all of this is appendicular. So, 5 points to this, and I say, what part of the skeleton is this in? You'd say appendicular. A point here, you'd say, okay. A point here, you'd say, a point here, you'd say, a point here, you'd say, that's still appendicular. That's not the vertebral column. So if I point here, then that's axial. Okay. Very good. All right. Bones of the skull. This bone is the frontal bone. This is the parietal bone, temporal bone, occipital bone, maxilla, mandible, zygomatic. You have the sphenoid, nasal, lacrimal, and ethmoid. All right. Look at sutures. Okay, going across the top of the brain or of the skull here. Sagittal. This one is sagittal because it's a sagittal plane, right? This one here or right here is the coronal or frontal suture. Okay, this one, and the coronal suture separates the frontal bone from the parietal bone, right? Sagittal suture just separates the two parietal. All right. What suture is along this line? Squamosal, and it separates the temporal bone from the parietal bone. This line is the lambdoidal suture, separates the parietal bone from the occipital bone. The structure here is your sternal-acoustic meatus, where it goes to your eardrum. And this little hole here is a foramen, called the Hol's foramen. And it's mental because its chin is mental region. So it's mental foramen. All right. Maxilla, right? Upper jaw. You see it here as well. It's your palatine bone. It's your palate. Okay. This is part of your nasal. All right. What about this? Sphenoid bone, right? Right here, this is your temporal bone and zygomatic bone. Okay. It's a bit of your parietal bone there, and this is the occipital in the back of the head, right? It's a large hole. This is fancy terms here for large hole, foramen magnum. Okay. Foramen's whole, magnum large. Okay. All right. In your vertebral column, you've got some regions. All right. So first two cervical vertebrae are your atlas and your axis. Okay. Biggest thing here is regions that I want you to know. So neck region, cervical, chest region, thoracic, and it kind of forms this kind of backward C area there. And then you've got your lumbar down here at the bottom, and sacral curvature in the coccyx, right? So, and sometimes, I'm not real big on the numbers, but if you want to know the numbers, one way to think about it is like times of the day and eating. So you have your breakfast, lunch, and dinner, 7 a.m., 12 noon, 5 p.m. Okay, so you could do it that way. 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae. All right, so this is your, what is this? Sternum, yes. Again, we got the ribs again. So 1, 2, 3, 4, 5, 6, 7. These are the true ribs, right? They have a direct connection. And then you got 8, 9, and 10. These are false because they're connecting via 7. All right. Then down here you've got 11 and 12, which are floating because they don't connect at all. All right. It's your coxal bone separated into 3 smaller bones. Big curvature here is your ilium. All right, this pointy part here, it's the pubis. All right, it's where the hip bones kind of fuse together. And then you've got the ischium around the curve and around the back. Okay, so don't get caught up on, at least in this class, we don't have to worry about is this left or right. So just kind of think about here's the big curve, here's the point, here's the small curve. Okay, so if you do it that way, you'll always know which bone it is. Big curves the ilium, small curves the ischium, pointy parts the pubis. Articulations. Again, what I really want you to know is which ones are immovable, which ones are somewhat movable, which ones are freely movable. Okay, and know those terms. All right. Synarthrosis, amphiarthrosis, diarthrosis. Okay, that's what I want you to know. All right. So I believe you also have this book or this picture in the e-text. If you go to the e-text, you'll see this exact same picture. All right, so it'll show you what each of these is or which of those 3 terms fit for each one. All right. Synovial joint, showed you that up there. Again, you see something that looks like this, it's the synovial joint. The bones are lined by articular cartilage, so they're not hitting each other. You got your joint cavity with your synovial fluid in it. It's your synovial membrane. All right, you've got a kind of a fibrous layer around it, which forms your articular capsule. Okay. So this kind of helps you deal with the pressure on your joints. All right, so on articulations or body movements, decrease the angle at a joint, you flex it. All right, so here I'm decreasing the angle of the shoulder joint or decreasing the angle of the elbow joint. Okay, if I increase the angle, I'm extending. All right, so this is flexion, extension. Sometimes you can go past the point of extension to hyperextension. Okay. Here you have rotation, lateral rotation, medial rotation, going away from the midline toward the midline. Abduction again, going away from the midline, adduction going toward the midline. going around circumduction, right? Y'all remember this at all? Okay. All right, moving your ankle toward the midlines, inversion, so the big toes up. Away from the midline to eversion, big toes down. Remember, this is anatomical position with the palms out. Turn your palms down, you're pronating. Okay, turn your palms back up, you're supinating. All right, with your ankle, toes up is dorsiflexion, toes down is plantar flexion. So if you get on your tippy toes, you're plantar flexing. Moving your thumb against your fingers, you're opposing. Your thumb is opposing your fingers, so it's opposition. Okay, muscles. All right. So the muscle in the forehead is on the side of your head, temporalis, back of your head. Okay, around your eye, orbicularis oris, around your mouth. Oh, sorry, I got that backwards. Around your eyes, orbicularis oculi, because oculi is eye. Around your mouth is orbicularis oris. On your cheek, the masseter. Your side of your neck, sternocleidomastoid. On your back of your neck, trapezius. All right, so you can see a bit of the trapezius here, your sternocleidomastoid. The chest, what's your major muscle here? Pectoralis major in the shoulder, the deltoid in the upper arm, biceps brachii, forearm, brachioradialis, right? Because it's by the radius. In the abdomen, middle of the abdomen, you have the rectus abdominis, and on your sides of your abdomen, you have your external obliques. Remember, oblique means diagonal, which is the way these run. All right. So your thigh, the front of your thighs has your quadriceps group. Major muscle here is the rectus femoris. Why is it femoris? The femur bone there, right? Okay, front of your lower leg, you have your tibialis anterior, because it's touching the tibia and it's in the anterior. All right, you can see a bit of the back of the leg here. You got your gastrocnemius. Posterior surface, again, you got a view of the back of the head. You have your occipitalis, good view of the trapezius, a little bit of the sternocleidomastoid, shoulder, deltoid, your arm. On the posterior surface, you have the triceps brachii. In the lower back, latissimus dorsi. Behind, you've got your gluteus maximus, also your gluteus medius. Okay, it's a smaller muscle. So just like the anterior surface, you have the quadriceps group. On the posterior surface, you have the hamstring group. Major muscle here is the biceps femoris. Okay, why is it femoris again? Femur bone. Why is it biceps? What does biceps do? What's your biceps brachii do? Flex. All right, biceps femoris. What does it do? Flex. Flex your leg at the knee joint, or flex your knee. And then you get another view of the gastrocnemius in the calf. All right. So here you got your action. So how this is going to work on Wednesdays, you'll have about 76 questions. Now, about 10 to 12 of those are going to be matching, and that's this stuff. Okay, so you're not going to write, like on the practice, you have to write your answer. On the actions, you don't have to write the answer, you got to match. Okay, you have like a list of the muscles, a list of actions, and you just write the corresponding letter. Okay, so All right, I didn't hear you. You're welcome, but that's okay. All right. So, all right. So for biceps brachii, it's going to flex your elbow, right? And it can also supinate the forearm. Biceps femoris is going to flex your knee or laterally rotate your knee. Okay. You can get a little bit of lateral rotation out. Also, it can extend your hip. So this is your hip joint. This is flexing the hip, extending the hip. All right, brachioradialis, extends, or sorry, flexes the forearm. Deltoid, it contracts. Abduct your arms. External oblique, so it helps you with rotation and laterally flexing your trunk. All right, which is basically your kind of abdomen area. All right, gastrocnemius, plantar flexes your foot, stand on your tippy toes. Remember, toes down. Frontalis, right, like the rock. Raise your eyebrows, right? So gluteus maximus. So your hip is flexed, it helps you extend it. Okay. And if you, so like if you do walk a lot of stairs, you'll feel it there. All right, gluteus medius is going to abduct your thigh and medially rotate your thigh. Latissimus dorsi in the back helps you with bending and also adducting, excuse me. So you're bringing arms back in, adducting, and medially rotating your arm. So like people do weights, if they do like cable curls, bringing the cables down, a lot of times they're working their latissimus dorsi. All right, mass eater helps you to close your jaw, elevate your mandible, bring it up so you can chew. Occipitalis, it contracts, pulls your scalp toward the posterior, towards the back of your head. Orbicularis oculi, behind your eyes, helps you close your eyes, helps you blink and squint. All right, orbicularis oris, helps you to close your lips and kiss. Pectoralis major, all right, helps you with flexing your arm, helps you with adducting your arms, and medially rotating your arms. All right, rectus abdominis. It's going to flex and rotate your vertebral column. Rectus femoris. Okay, it's going to extend your knee and it's going to flex your hip. All right. So that is basically what's going to be on the practical. So what I'm going to do now is we're going to go into the lab and we'll look at the cadaver and review the muscles over there as well.